So the TRITON2 study is for patients with metastatic castrate-resistant prostate cancer who've had prior novel anti-androgen and one line of prior chemotherapy. And it's a single-arm study for patients who have one of a number of DDR deficiencies, which would suggest that a PARP inhibitor might be effective in that population. So predominantly BRCA, BRCA1 and 2, but also at the beginning of the study ATM, CHEK and a cohort of other genes in that family. So, and the results that were published today, or the poster of today, has shown very promising activity, particularly in the BRCA1 and 2 population, with in patients with measurable disease, a response rate around the 50% mark, and in the PSA responses slightly higher than that, and the responses would appear to be durable, and the drug is well tolerated. So overall, good news for these patients. So I think firstly it means that we need to be testing patients for these defects, and I think you can do that in two ways. So you can have a germline mutation, or you can develop one as your cancer progresses. So you probably need to do you need to be testing patients later on in their disease process, as well as doing the germline testing. So that obviously has challenges for us as physicians, and also for our administrators and how to pay for that. But I think because we need to identify these patients, because the clinical benefit, this is an oral agent which is relatively well tolerated, so the implications for the patients are good. If they have one of these mutations, they're going to have another treatment which will add time without their disease progressing, and hopefully give them a better quality of life. And therefore they should get it. If they're suitable for it, they should get one of these drugs. So there are some side effects, particularly nausea at the beginning. Fatigue is another issue that can arise, and anemia. They're probably the biggest side effects that we've seen with the drug. But generally speaking, people are able to, the number of people who have to come off the drug because of adverse events is low, and it's usually manageable. The toxicity is very manageable for most patients. So I think this is in patients who've had line chemotherapy and a novel antiandrogen. There's also a randomized study, which is TRITON2, which is earlier on in the disease process, randomization to the physician's treatment of choice, whether it be chemotherapy or another antiandrogen. And I think you'll see today, but also tomorrow, that PARP inhibitors are going to come earlier in the disease process in prostate cancer, a bit like we've seen in other diseases.